Hello, and welcome back to our channel. It's wonderful to have you with us. Today, we're going to talk about something really important. Something that affects millions of us as we get older. Medical screening tests. As we age, we often think that getting more tests is always the best way to stay healthy. But I'm here today, as a doctor who specializes in the health of older adults, to share a surprising truth. After you turn 70, some of these standard tests can actually do more harm than good. You see, many medical guidelines were created for people in their 50s or 60s, but our bodies are different in our 70s, 80s, and beyond. What was once a helpful test can become risky. We start running into two big problems: overdiagnosis and overtreatment. Overdiagnosis is when we find a condition that looks scary on a test, but would never have actually caused you any harm in your lifetime. Overtreatment is when we use powerful, sometimes risky, procedures to treat these harmless findings, leading to complications that can seriously reduce your quality of life. So today, I want to share the 3 most common tests that you should think very carefully about, and even consider refusing after you turn 70. Let's start with the first one: routine colonoscopies, especially after you reach the age of 75. Now, for middle-aged adults, colonoscopies are fantastic. They find and remove little growths called polyps before they can turn into cancer, and they absolutely save lives. But after 75, the balance of risk and reward changes a lot. First off, the procedure itself becomes riskier for an older body. The chance of a serious complication, like a tear in the bowel, is much higher for older adults. The sedative medications used to make you comfortable can also put more strain on your heart, and that difficult bowel prep you have to drink beforehand. For seniors, it can cause severe dehydration and throw your body's salt balance out of whack, which can lead to falls or even heart problems. But even more importantly, the benefit just isn't there for most people over 75. Colorectal cancer usually grows very, very slowly. If you had a normal, clear colonoscopy when you were 65, any new polyp that might grow would likely take 10 or 15 years before it could become a serious threat. So, for a healthy person over 75, you are far more likely to live out your natural life and pass away from other causes. Asterisk with asterisk. A tiny, slow-growing cancer than you are to die. Asterisk from asterisk. This is why major health groups, like the US Preventive Services Task Force, ACTRA advise asterisk against asterisk routine screening after 75 for people who have had normal results in the past. It just doesn't make sense to risk the serious complications of the test for such a tiny potential benefit. Okay, let's move on to the second test I want you to be cautious about: aggressive PSA testing for prostate cancer, especially after age 70. The PSA test is a blood test that can be a sign of prostate trouble, but it is famous for causing overdiagnosis in older men. Here's why. As men get older, it's extremely common to develop very slow-growing prostate cancers. In fact, if we look at men who have passed away from other causes, like heart disease, we find that a huge number of them had small prostate cancers that they never even knew about, and which never would have harmed them. The problem starts when a routine PSA test comes back a little high. This often leads to a biopsy, where a doctor takes small pieces of the prostate to check for cancer. A biopsy isn't a simple procedure. It carries a real risk of serious infection that can be especially dangerous for older men. And if that biopsy finds one of these common, slow-growing cancers, the pressure to do something begins. Doctors might suggest surgery or radiation to get rid of a cancer that was posing no real threat. And what's the result of that treatment? Too often, it's permanent side effects like trouble controlling your urine or problems with sexual function. You could trade a good quality of life for a treatment you never really needed. So, unless you're having actual symptoms, like trouble urinating, or have a very strong family history of aggressive prostate cancer, routine PSA screening after 70 is more likely to harm your quality of life than to extend it. And that brings us to our third and final test to reconsider: routine cardiac stress tests if you have no symptoms. Let me be clear. If you are having chest pain, getting tired very easily, or feeling short of breath, a stress test is a very important tool to figure out what's wrong with your heart. But doing this test on healthy older adults who feel fine is a different story. It often kicks off a chain reaction of unnecessary and risky procedures. First, The stress test itself, especially the kind where they use medicine to stress your heart, can sometimes cause heart problems in older individuals. But the bigger issue is that these tests have a high rate of false positives. This means the tests might look abnormal, suggesting a problem when your heart is actually fine. In older, symptom-free people, as many as half of the abnormal results can be false alarms. But of course, an abnormal test result makes everyone nervous, so you'll likely be sent for the next step. An invasive procedure called a cardiac catheterization, where a tube is threaded through your blood vessels to look at your heart. During that procedure, the doctor might find a minor blockage, say 40% blocked. That kind of blockage is very common with age and almost never causes a heart attack. But feeling the need to be cautious, the doctor might put in a stent to open it up. So now, you've gone through an invasive procedure for a blockage that wasn't a threat, and you'll have to take strong blood-thinning medication for the rest of your life. These medications carry their own serious risk of causing major bleeding. All of this started from a screening test you didn't need in the first place. Studies have shown that healthy seniors who get these routine tests do want to live any longer, or have better heart outcomes than those who do UNT. But they do suffer from more complications from all the follow-up procedures. So, what should you do? How do you make these smart, personal health decisions as you get older? The most important thing is to have a good, honest conversation with your doctor. Before you agree to any of these screening tests after the age of 70, I want you to ask for very specific questions. First, ask this. Given my personal age and health, what is the real chance this test will find something that will actually threaten my life in the years I have left? Second, ask, what are the specific risks of this test and any procedures that might follow? I'd like to know the numbers, not just a general it's safe. Third, ask, if we find something, what will we actually do differently? Will this discovery truly change my treatment in a way that improves the quality or length of my life? And finally, the fourth question. What do the major medical organizations actually recommend for this screening test for someone my age? It's important to know that some doctors may still be following older, outdated advice. Healthy aging after 70 is not about hunting for every possible problem. It's about wisdom. It's about supporting your body with good food, staying active, connecting with people you love, and managing the health conditions you already know you have. By avoiding these aggressive screening tests that can cause more harm than good, you can focus on what really matters, leaving a long, happy, and high-quality life. Thank you so much for joining me today. I hope this information empowers you to be your own best health advocate. If you found this helpful, please give this video a thumbs up and consider subscribing to our channel for more advice on healthy aging. We'll see you in the next video.